everyone, my name's Hunter. I'm going to be doing the head and neck physical assessment on my patient Lily here today. So what we're going to start with, we're just going to start with kind of like assessing like her general face and head. So I'm looking for symmetry, looking for normal coloring, no lesions or anything like that, and she looks symmetrical. Can you smile for me? Yes. Okay, awesome. So then I'm going to go ahead, I'm just going to feel your head gently, okay? So I'm just going to kind of feel with my fingers here, looking for anything physically that I can feel, or asymmetry. Do you have any pain or tenderness anywhere?
No.
No. And I don't feel any lesions or anything, so that would be a normal finding. Moving down a little bit, I'm going to palpate the temporomandibular joint, so just open and close your mouth for me. Good. Okay, and so you shouldn't feel popping, you shouldn't feel any pain. Was that hard for you? Was it painful? Okay, good. So that would be a normal finding. Then to go ahead and move on to our sinuses, the frontal sinuses, we can palpate here gently. Any pain or tenderness?
No.
Okay, good. And then I'm going to push under your eyes. Any pain or tenderness there?
No.
Okay, and that's normal. Moving on, we'll assess our lymph nodes here. So the preauricular lymph nodes are right in front of the ear. So I'm just going to gently, with the pads of my fingers, kind of work my way around. Postauricular is behind these ears. Our tonsillar is kind of underneath the ears and at the start of the jaw. Working our way down, these are the submandibular, submental here. Good, okay. And then moving on to the cervical lymph nodes, can you turn your head that way a little bit for me? Perfect. So I'm going to palpate here along the sternocleidomastoid muscle. They are deep, so they might be hard to palpate. And then just turn your head towards me. And feeling along that muscle there again. And I can't really feel her lymph nodes there, but that's normal. For the anterior cervical, kind of feeling in front of that muscle there. And then posterior cervical would be along the back of that muscle. We also have lymph nodes above and below the clavicle. So above would be the supraclavicular here, and below infraclavicular. And then there's some occipital kind of behind the neck. Blend those there. And like I said, normal finding would be a pea-sized kind of nodule. It should be movable. If they were enlarged or hard or not freely movable, then we might consider doing some kind of follow-up or further investigating that for you. I'm going to come stand behind you for a second. So moving on to our thyroid gland, I'm just going to kind of feel here for it. Okay. And then once I have my position, go ahead and just swallow for me. Okay, and I'm just feeling for enlargement. It feels normal size. It's symmetrical. I don't feel any masses or anything there. No pain for you?
Nope.
Okay, all right, and that would be the end of our assessment. Thank you.